Hello, I'm Dr. Deepak Devakar, dermatologist and hair transplant surgeon. I've been practicing since 15 years plus in Dermasculpt skin and hair clinic. So today is your third day after hair transplantation, the third post-op day. So what are you supposed to do today? You have to keep spraying a normal saline spray which we have provided to you every 1 hour till you sleep. You can avoid doing spray at night. Only during the day you have to do it every 1 hour. You should not touch the recipient area today, the donor area from the back of scalp or the beard area or the body. If it is done, then this has to be cleaned with a mild shampoo. What we have, baby shampoo you can use to clean the area. Tap and dry the area and leave it open. Apply an antibiotic ointment on the donor area. The recipient area should not be touched. Continue with all the medications what we have given, antibiotics, painkillers and ointments, tablets, antacid what we have given, continue everything. The recipient area will have brown crust which is visible. This will be visible like this for the next 2 weeks. If you have to go out, you can start going out from today. But don't stand out in sunlight for hours together. Just go out, sit in a cab and travel. Long distance travel is fine. No need to be concerned. You can wear a loose fitting cap like a baseball cap. It should not be hugging very tight. Skull cap should not be used. You can't wear a helmet for almost a month. You can't do any exercise, intense workouts or pumping exercises. Blood should not happen. So don't do any vigorous exercise or walking also. Casual walking can be started in the evening or early mornings where peak hour sunlight should not be exposed. You can't stand out in sunlight for hours together. It should be only for few minutes if you want to travel. Otherwise, if you have opportunity of working from home, you can continue working from home. You should not sleep on your face down at night as it may cause more swelling. There is a possibility on the third or fourth day you can start seeing swelling on the forehead which can trickle down around your eyes and there may be some swelling. In some patients we have very minimal swelling which will reduce with the medication already we have provided. In some patients the swelling can be more based on their health condition, but it is nothing to be worried about. This is just a fluid collection and plasma collection which is happening under the skin and it will not cause you any side effect. Even if the swelling is there around your eyes, it will not cause any issues with the eyes. There is no blindness or eye problem will not happen with it. So nothing to be worried about. The swelling will go by itself. You can apply some aloe vera gel and gently massage from the center to the outward direction. If your swelling is more, you just sleep on your back and just let the fluid drain for half an hour, 1 hour. If you do that in between 2 to 3 times a day, the swelling will come down by itself. If required, we will suggest you some medications also if the swelling is more. So sleeping position is also important on this day. For the next few days, don't sleep on the sides if you have done transplant on the temporal area or the sideburns. You can sleep on your back if the frontal area is done. You can sleep on the sides if only the frontal area is done. The vertex is done where the crown area transplant is done. Then sleep on your sides. You cannot sleep on your back because this hair which is transplanted which may touch the pillow and the hair follicles may come out and hair will not grow in that area. So for the next 10 to 15 days you have to avoid sleeping on your back if you have done on vertex area and on the sides if you have done on the temporal area. So the position can be fixed if you are using long bolster like pillows on the sides if you are sleeping on sides at night so that you don't accidentally turn. If you are sleeping on your right side, keep the pillow on your left side supporting your back. If you are sleeping on your left side, keep the pillow on your back on the right side so that you don't accidentally turn at night when you are sleeping. Brown crusts will be visible. This can be there for 10 to 15 days. You can avoid smoking and avoid drinking. Don't have any heavy, oily, spicy foods for the next 4 to 5 days. All the best. Your hairs will grow well. Take care. Any doubts is there, you can contact us. Thank you.